Hi, my name is Mark Goldstein. I'm going to be your MC for a great bunch of, there are 4 amazing startups you're about to see. My background is I've been an entrepreneur, but in the last 5 or 6 years, I've been all in on healthcare. I have a fund called the Advisors.fund, and I've made about 35 to 40 healthcare-related investments in diagnostics, big data, a number of sensor companies. Got involved early with Fitbit and ZocDoc, more recently with Forward and a few others. Really excited about this space. And coming out of this last panel, where you saw the venture capitalists talking very specifically about this opportunity, I think this opportunity is even bigger. I have a partner I'm working on a new business with whose name is Dr. Michael Roizen, who is the head of wellness at the Cleveland Clinic. And he's written all of the sort of best-selling books on wellness. And he calls this, we call this, this is the tip of the spear. If you want to reduce healthcare costs, maybe it's through value-based care and the like, it's going to be through stress reduction, and it's going to be through everything we just heard about in the first panel. So this is the tip of the spear to get healthcare costs reduced, and why this is such an exciting panel. The companies you're about to see are really, really important for 5 reasons, and I always like lists, so I'm going to do 5 reasons. One of which is, I got to write them down too, so sorry about that. But basically, what these next companies are doing is they're mitigating the big money that's going to go to chronic and acute care. And they're going to prevent the serious stress, addiction, depression, and sickness causes that companies and individuals are going to face. Number 2 is basically it's going to reduce the costs that payers and employers have, because they're going to be able to front-end expensive therapists, front-end expensive ER visits. And that's what you're going to see from these next companies. So these companies represent amazing cost reductions to the way that individuals and employers are dealing with this problem today. Number 3, it's all about millennials and their phones. All of these companies are basically mobile first, and mobile first in very innovative ways. Number 4, basically it's also about employee retention and sick days being a big issue. And these companies will reduce that. And number 5, it's basically the fact that we found a few years ago is that labor marketplaces and the like haven't really worked. These companies are thinking about really, really smart ways where it's not about connecting you with expensive people. It's about doing it through the phone. So let me start. And let me start by basically, we're going to start with our first company, which is called Bravely. Richard Lee, who's sitting right in front, is a little bit of a non-conventional healthcare entrepreneur. He started a very successful mortgage company and a successful chain of steakhouses. So he knows how to grow a business. And he's going to give you a sneak peek of something that's launching next week, which is a really, he's calling it, he's rethinking, basically, he's calling it a relearning campus, and he called it EdTech-ceutical. Richard.
Thank you, Mark. Thank you, everyone. So I'll start off with the question, why? After trillions of dollars spent, plethora of experts, we're still suffering all-time high levels of SAD, stress, addiction, depression, sickness. Where nearly 8 out of 10 of us are suffering it today. My name is Richard Lee. Bravely, we're the world's first EdTech-ceuticals. Our mission, democratize I love my life. We're the peer-to-peer e-learning campus where adults prevent stress fast, gain health to success, at a speed, cost, and success rate that competitors can't match, through our advanced social emotional learning. Just do 5-minute guided phone calls with fellow members anytime, anywhere. Our power call is a digital validated to radically reduce stress hormones, trigger neurogenesis, cause healthy behaviors in the world's largest neuroscience study. In the same study, 1 year by Max Planck, mindfulness failed to lower stress hormones. And we are validated by clinical professor of neurosurgery, Dr. James Doty, at Stanford Medical, founder of C-Care at the Stanford University School of Medicine. I began my quest in behavioral health 37 years ago in trying to cure my own chronic SADS as an orphan with level 10 trauma. Compared to level 1s, level 10s incur a 200 times likelihood of behavioral dysfunctions, which cause such high likelihoods of mortality rates that most level 10s don't live past 35. Bravely saved my life, and it powers my life today. So why is SADS at all-time highs? Main reason, because the helping industry suck. Stigma. 7 to 9 out of 10 people are ashamed of seeking mental health. We all know that. and anonymous therapy apps creates the same shame that causes SADS in the first place. Unsuccessful. Shrinks, pills, self-help, mindfulness, corporate trainings all suffer near 100% failure rates. We deserve better. Costly. Nearly 3/4 of people, maybe not here in Palo Alto, cannot afford current offerings, even in app form. Kills hope. Nearly half of Americans have given up trying to get better because the helping industries, which are over 150 years antiquated, suck. So what does work? Social emotional learning, the education for emotional intelligence. EQ is already well known to be the top predictor of success, health, and happiness. So how do you democratize SEL? You need 2 more components. One, SEL is peer-to-peer learning, where someone needs 3 to 5 confidants, which basically no adult has. Bravely solves that with our eCampus. 2, most adults don't have time. So Bravely is the best practice with our 5-minute power calls to radically reduce stress, and at the same time, it's SEL education. So combine SEL, peer confidence, power call, you have scalable, you have the most powerful. Our traction, we have raving fans. We have retention rates of 10x that of competitors after 2 years measurements, and we have a long waiting list of leaders from the likes of Google and Apple waiting to use our app. Our initial market, corporate training, $270 billion a year business globally, of which nearly 70% of spend is on EQ competencies. Bravely solves the #1 problem for employers and payers alike. Employers want to earn more money, save more money by having employees with higher EQ. And payers want to reduce levels of SADS, which Bravely solves. So with our freemium model, we are the perfect total solution that both employers and payers need. We're a team of career entrepreneurs and senior leaders from Apple Digital Health to Oculus. We've created 2 publicly traded NASDAQ companies with experience from AI, advanced social emotional learning across software development. So I want you to remind you, what would a world be like without SADS, where everyone could say, I love my life? Thank you.
Well, I wouldn't bet against this guy. And you can see why he won the Startup Health contest in January.
We started a raise last month, and we already closed our raise. So watch for us in top tier VCs.
Any questions?
So thank you.
No questions. Questions are later. That's what I thought. Okay, next is Helena Platter-Zybeck, and she, I think I've got that right, and Supportiv is an amazing company. She used to run Scholastic's EdTech division. She knows how to basically get software out there and get millions of people to use it, and I think you're being real excited about what you're going to see.
Put it so far in my pocket I can't reach it. Okay. I decided to have a little fun with this. Start with the question. The answer is that, yes, there's a lot of expertise out there, and we have 289 solutions that have been created with proven protocols and randomized controlled trials out the wazoo, but there is always going to be half the population that is never going to engage with them because they hate it, because it's boring. They want real people to talk to them that are just like them. They don't want experts shoving something down their throats. So why aren't we actually building products for the clients that are not going to engage with us anyway? Let's be a little bit more populist about it. That's what we're doing. So we looked at Psychology Today. They did an interesting survey last fall, and they asked why people never go to therapy. And the actual question is that they'd rather talk with their friends. Now, that's fantastic, only we don't talk with our friends anymore because they are busy. And when we go to find them online, we become miserable looking at their seemingly perfect lives. So what we are doing is throwing all that out the door and saying, hey, we're a tool that's going to connect you with people that have the exact same life struggle that you have at the exact same moment that you're having it. It's pretty easy. Is it evidence-based? Yes. I'm going to skip all that. This got a little messed up, but what you're seeing is we have a solution that does not involve therapists. There is no screening questionnaire. There is not a diagnosis. There are no protocols and 12-week care pathways because people hate that. And yet we have grown in just a couple of months organically with no marketing money to under 50,000 users that are staying on our platform, chatting with peers, going through the same problems as them for 22 minutes, and they're coming back. This is what they're saying. They're just saying they feel better. This is the little like maintenance gym visit that we were talking about earlier. And we're giving them purpose, because when they connect with people going through the same thing that they're going through and they start helping each other, they feel like they have something to come back to. So what is precision peer support versus regular peer support? First of all, I'd like to say that my co-founder, who's here, Poria, has been working in machine learning and healthcare for over a decade, way before it was cool. And I have a background in adaptive learning technology and consumer trend indication and projection at media companies. But I've been in digital health for 4 years, and I've already led a product from pre-product into commercial contracts with payers. So we know the system. We decided to boil everything down to one question, which is not a boring questionnaire question like, are you tired some days? It's, what's your struggle? That's literally all we ask. And here's what happens. People start typing in real text, and we use natural language processing. Now, Spacey is industry gold standard NLP used by unicorns all up and down Silicon Valley. It's the fastest processing time. It's heralded everywhere. And we decided that it wasn't good enough for us. We have built our own proprietary corpus. And we are able to not just match one user to each other, but groups of users, up to 10, concurrently in real time that have the same problem, not using keywords. What else can we do to make peer support better than it is in real life? So, of course, instant access with the push button. It's anonymous, and we have superhuman live moderators that fly in like Lyft drivers and appear to moderate the group. And they can make emergency referrals, and they help operate our magic hyperlinks. So we are crawling the conversations in real time and surfacing resources that are going to become useful, including other services that exist in the healthcare system. And we have a business model. We're going back to the party lines. We're charging people 15 cents per minute, and they like it, which means we can pay our moderators who are psychology students. So we have a video. It's going to go real fast. This is the actual user experience. In under 30 seconds, you end up in a support group tailored to you. You type whatever is going on in your mind, and that's it. Boom. Now, this code is here because if you're with an organization, we can aggregate your data on the back end, but it's anonymous, and you choose your own display name. So that moderator has popped in like the Uber driver. They've been alerted that someone needs to talk. And you will see that they already are getting validated, listened to. And in just a minute, another user is going to come in because our NLP is matching the users in real time as they join on the platform. This person also has a work-related issue. We actually have male users. We skew male. We're 56% male. And in a minute, you're going to see the moderator suggesting a relevant article. It's very simple. The hyperlink will pop up, and that's it. That can be anything else in the healthcare system too, including referrals to psychiatric care that they may have available on their health plan. You are literally seeing the entire experience in under a minute. This is all that it is. It makes people very happy. They feel better. It's that little gym visit for your mind. Okay, thank you.
Excellent. Well, that's clearly of someone who knows how to write some software. That's amazing. That's just launching this week, and it's no surprise you got 50,000 people already. Christian, there you are. Meru Health, the third company.
Thank you.
Different entrepreneur, ex-musician, but now lives in Palo Alto from Helsinki. He's been working on this project now for a number of years. It's a second company, and it's basically an online medical clinic for depression and burnout treatment. Boom.
Thanks a lot. Back again. Okay.
Works even. Okay, now it works. So, hi, my name is Christian. I'm CEO and founder of Meru Health, and we're an online medical clinic treating depression, burnout, and anxiety. And why I founded the company was that when I was running my previous company in diabetes, I unfortunately lost my brother, Peter, to suicide. And I kind of made a decision back then that once I'm out of my previous company, and once we sold that business to a Korean public company, I wanted to go in to help other people like my brother. And having 12 years in medical devices and digital health was something that given some perspective on kind of how to move things forward. So, you know the problem, so I won't spend too much time on this. But depression, as an example, is the single biggest cause of disability in the U.S. today, and a lot of access problems, a lot of cost problems for employers. Okay, so what is Meru Health? What is our solution? So we're basically an online clinic with remote therapists and remote MDs, and we have a digital therapeutic program which people go through for 8 weeks. And what it means is basically that people do CBT practices, mindfulness practices, breathing practices. We tailor the program based on their specific needs, and then people get to work together with their dedicated licensed clinician and MD. And the point is that kind of brings a lot of accountability and a lot of good adherence, which is one of our strengths. So we're able to actually be very, very effective in treating people and keeping them engaged. Within a fairly challenging group of people. And then anonymous peer group, so that's kind of like tying into the discussion about the networks people have and the importance of networks. So in our case, it's an anonymous peer group where people get connected with other people who are sharing similar problems or going through similar kind of treatment program. Okay, how does it work? So basically, let's take an example from WeWork, one of our customers. So we just recently launched with them. So basically, their benefits director send an email out to their staff that, hey, this is available, this is discreet, this is confidential, and if you have any of these challenges, you can check out Meru Health here. This is their landing page, their sort of explanation on who they are, and then there's a link where people get to take a self-assessment, which eventually, if they so wish, ends up to our licensed clinician's phone interview, and then that's how the journey begins, and then people are getting into treatment. During the treatment, we tailored the program based on our analytics and understanding people's needs and preferences, symptomology, severity of symptoms, stuff like that. And then at the end, we produce a report for the person or for a provider that has referred the patient. Okay, so our outcomes are really good, and that's something we're kind of super proud, and we're about to publish 2 papers later this year. We're seeing roughly 2.5K cost reduction for an employee. Who go through the program, and basically comparing against some of the current traditional treatments, we are clearly doing well. But on the other hand, we also treat people who are, as an example, on antidepressants, because there are definitely reasons for people to be on them sometimes. But then again, what we're seeing is that actually most people who are being treated by us are not on antidepressants, and people are definitely seeking for other alternatives nowadays. Okay, so our specialties are outcomes-based pricing, and this is our stance. So we really believe in what we're doing, and we're willing to totally be risk-based pricing. And there's some details there. Happy to talk to you if you're interested in more about these details. But that's sort of our promise to our customers, the companies we work with, and the patients. Some of our partners and customers, Palo Alto Medical Foundation. Then we're doing some research with Stanford, WeWork, Zendesk, and so on. And then, I will end here with our key differentiators in the market. So thanks a lot for having me, and happy to answer any questions at some point, I guess. Thank you.
That was excellent. I mean, it's pretty crazy that you could have that type of data this quick in the process. And look at the efficacy that it's showing. It's great. Okay, our last company is called 7 Cups. And 7 Cups is sort of the vet of the group. And where's Glenn? There you are, Glenn Moriarty. They've been around for a while. So they're sort of our pioneer. It's probably the first time you've ever been called a pioneer. They have in a group of other companies. They have 27 million conversations online. They're a online therapy and support and find your listener. And I actually used your product this morning, and I loved it.
Awesome,
yeah.
Thanks. Thanks for that great intro. Yeah, so the reason 7 Cups started is I'm a psychologist. My wife's a therapist. I was talking to her about a problem. As most of us, whenever you're going through a hard time, one of the first things you want to do is you want to talk to somebody about it. And when you talk to somebody, you feel better. And it occurred to us, wouldn't it be great if no matter who you were, no matter how much money you had, no matter what language you spoke, you could get that help. You could have somebody, a compassionate listener, kind of care for you. And that's how we started. I was the first listener. Went through Y Combinator, learned a lot about consumer technology. We launched with voice. Turns out voice was too intimate. As we talk about these systems, face-to-face, video, voice, pretty intimate. Anonymous messaging, non-threatening, And that's a way to access the door to get a lot more people help. So that's what it is. It's all messaging based. We have 260,000 listeners in 189 countries, providing support in 140 languages. That's really the core of it. In addition to that, we have growth paths for the clinicians in the audience. These are treatment plans, so bite-sized exercises to help people overcome specific issues or challenges. A third component is we use a digital task sharing model. So anybody on the platform that needs extra help can be referred up to a therapist. We have 160 licensed professionals on the platform. And here's just some representation of us around the world. In terms of comparison with, the traditional mental health system, you can see just quickly, on demand, oftentimes just minutes to get help versus sometimes weeks or months. No cost, no stigma. Community, as Bambi has, I think, commented repeatedly throughout the evening, really a core part of what we do. We think in general, community is a core part of helping people live better lives and get better. And it's something that's kind of missed. It's really a core part of us. We believe in the kind of the AA for everything model. No matter who you are, you should be able to connect with somebody who's in the process or further along the path of recovery. Really the cool thing about 7 Cups is in any given region, we're reaching 1 to 3% of the population already. So you can think of on-the-ground services here, and you can think about us, and what we're beginning to do now with health systems is bridge these 2 lines so we can drive better outcomes. Thank you. This is another model. You've got clients and family, people that are struggling. They're coming to 7 Cups, using our services. We're networking with folks on the ground, building a social safety net where we can refer people on the ground to get better care. Likewise, people have coming into their systems, long wait lists, people that might need extra help, they can refer them to us, we can provide collaborative care. We have dozens of clients in universities. Now we're moving towards payer systems and county mental health systems. Oh, look at that. I've probably got 20 seconds left. In addition, we track outcomes, all the data points made earlier. We have a chat bot that does some very interesting stuff with all the listener message data. So as we know what listeners kind of perform the best, so we can create data models through our chat bot to kind of provide extra care. But it's really a treatment spectrum approach where you have bots that are happy to send reminders all day, things that humans don't really like doing. You have volunteer listeners, you have therapists, and together there's this kind of collaborative treatment plan, treatment spectrum to drive better outcomes. Thanks.
Wow. That's incredible progress after a few years. How are we doing time-wise?
4 minutes.
4 minutes. So we're going to basically be able to take on a few questions and for Q&A. And remember, all these companies are here. They're going to be around. They're also here. Some of them, a lot of them are fundraising. They're looking for customers and clients. They're at the perfect stage, and you're exactly the audience they want to talk to. And let's get some Q&A. Let's get some questions. Who would like to ask some questions to any of our 4 panelists? Oh, come on. There's some great companies. We've got to get some questions. Okay, Bam, you want to ask the first question? Well, I will. So, Glenn, what surprised you? It's been 4 years since YC. So you said voice didn't work, but tell me the aha moment when you said, "Oh my God, I hit it."
So I'm a psychologist by training, and of course, most clinical work. I'm a psychologist by training, and most clinical work is face-to-face, so that's kind of the core assumption. And we launched with voice, and it was crickets. And we did a bunch of qualitative interviews, and we said, hey, why isn't anybody using this service? And it turns out people are saying voice is just too intimate. So if you think about our current treatment system, think about somebody brought up Amazon, right? Somebody used an example of Amazon earlier. What if Amazon has what, the one-click buy, right? The reason they have that is because internets have funnels, right? So the less steps you can make something, the more people will complete it. So if there's 10 steps and 1,000 people, you only end with 100 at the end. So we have to make it in a way so that people can get help with less steps and less threatening steps. And the anonymous messaging you can do in like 3 steps, and it's not at all threatening. So much more people get help.
Great. Richard, what would be your answer?
Yeah, I'd like to humbly counter that. So 7 years, 5 beta tests regarding voice. Many studies, you guys can Google today, text doesn't trigger the oxytocin needed to reverse stress cortisol. It's completely already a fact that when we hear voices of people that we trust and we we trigger our mammalian caregiving system, we trigger oxytocin, serotonin, upgrades epigenetics, neurogenesis, behavior change like that. So for our model, not yours, our model, the reason people feel unsafe in current models is because the platform's unsafe. Our raving fans don't feel unsafe. So we have a lot of mechanisms in place that allows people to feel very safe when they hear somebody with a comforted voice. 5 minutes triggers oxytocin, serotonin, all the things begins to happen. And what I just said is already in the medical books. You guys can find that out. So for us, voice was awesome.
Different strokes for different folks. But great, you're going to both found your business models. I know we had a question.
I guess I'll transduce my observation into a question. What I'm observing is what was going on back in the 90s with the gaming industry, that there weren't enough of business models and participants for people to get traction. And then the groups who were going into gaming said, we have to help wake the market up and work together. So my question is, do you feel competitive with each other, or do you feel collaborative and on the same side, waking the market up?
Well, I can answer that. We believe that 75% of SaaS is all behavioral, beginning with epigenetics, stress, and we can deliver the reverse of that. So said differently, we don't want to play within the box of healthcare. We're creating a whole new box.
But with the other companies.
No, we feel, just look at the stats. You got 100% failure rates. I mean, how many trillions do we want to keep throwing out? I don't want to insult anybody, but disruption does break some eggs. How many trillions do we want to go out? I'm a business guy. I don't keep throwing trillions and trillions of dollars at problems that aren't moving. 2017 APA just put out, stress is at all-time highs again. Depression is at all-time highs again. What we're doing is not working.
What do you think?
So
Linda?
I would take the opposite approach. So I think that there are a lot of solutions that are working. But the thing is that they're working for pockets of the populations, and there are still underserved pockets of the population. So
but that's the problem, though. See, we keep chasing bad fruit. We don't take care of the soil. And so all my favorite
well,
places
but I
are-
want to talk about collaboration. I don't want to insult other solutions. Are we?
So are we,
Yeah. So
Collaborating or competing?
the genesis of Supportiv was that my co-founder and I looked out at the ecosystem of existing solutions and said there are so many of them, but they're all selling to employers and health plans, and there's not really a consumer solution that's working. Consumers should have access to just as many of these solutions as possible, but there's no funneling mechanism. So part of what we set out to build was this precise recommendation and referral system that's going to shoot people who need these other solutions into them. But the mechanism by which we are going to find out what they need is them talking to each other in natural vernacular.
Okay, can I ask a question? Want to disprove Lisa Sunan's hypothesis? 2 words from each of you, all 4 of you. Only 2 words. Can you do 2 words, Richard? Maybe. I doubt it, but anyway, let's try. Who pays now? Who pays later? Helena, who pays now? Kristen, who pays now?
Well, in our case,
2 words. Who pays now?
employers,
And who pays later?
the insurance companies.
Helena? Who pays now?
Opposite, consumers now, and then eventually health plan coverage for everyone.
Glenn, who pays now?
Consumers and organizations in the same later.
For us, advertisers.
Now and later?
Solved.
Both? Now and later advertisers. Okay,
Solved.
thanks.
well, that's amazing. That's why that's why you have different strokes for different folks. And this is such early days. That's the amazing thing. Such early days for this. We're going to be coming back in a few years, and we're going to say, "Oh my God, I was at this Vader panel when these companies were launching." Wait, hold on, Richard. And of course, okay, after me. And that's the beauty of this. That's why this is These are 4 companies we're all going to be reading about. And I think now our time is definitely up. And with that, I'm going to...
Mark, I just want to say one more thing.
Oh, okay, bring it on.
So one of the biggest fallacies, and again, you guys can do your own research. There's this fallacy of community that we just get a bunch of people together. Listen, Robin Williams had a ton of people around him. Anthony Bourdain had a ton of people around him. It's not just bodies hanging out. Do the study. Harvard just blew out 12 steps, 96% failure rate. Okay, because it's supposedly this whole community of people. It's got to go deeper than that. People have to learn how to reconnect with themselves on a very deeper level. Therefore, we can connect deeper with others. And that's what social emotional learning does. And so for us, we have the advertisers to pay for that.
Excellent. Great group, great panel. Speak to these guys. I'm going to hand it over to you.